What would you say some of the biggest concerns with pregnancy and rheumatic diseases include?
I think for a long time, people with rheumatic disease in general, but particularly people with lupus, were told that they should not get pregnant. And I think probably the most important message to get out there is that we know that in the majority of cases of people with lupus can absolutely anticipate a safe pregnancy. If you have a really active kidney disease or you happen to have this coexisting lung disease called pulmonary hypertension, you can certainly potentially go on to have a very high risk pregnancy. But the reality is that over 95% of people with lupus end up doing just fine and have a healthy pregnancy and have a really healthy baby. And so I think the thing that we really want our patients to understand is that when they get pregnant, it should be when their disease is under good control and when they're taking medications that they can safely continue during pregnancy. Because we know that if your disease is under good control when you get pregnant, then you're much more likely to have a healthy and safe pregnancy, both for the birthing parent and for the developing fetus. And so the
Absolutely.
take home message, the best pregnancy is a planned pregnancy.
That makes sense. I think honestly that's true for so many people. I'm happy to discuss more about nutrition, but a lot of the things that we need from our prenatal, we should start before a pregnancy. So oftentimes doctors will say, oh, start your prenatal, let's say 3 months before you plan to become pregnant, because there's certain nutrients that fetus needs instantaneously,
Yeah.
folic acid in particular. So when anyone is planning maybe to create a family at some point in their life, I do recommend being thoughtful about when you want to start because it's great to get your health in tip-top shape, and that includes prenatals, maybe changing medications, and that can take a while too.
Hmm.
Um, does MedStar, and maybe this is the wrong question to ask, have any resources that are public about lupus and pregnancy? I have seen some from, I can't remember the institution, but they have it as abbreviation HOPSTEP. And it
Mm.
actually talks about the pregnancy medications that are safe or medications safe in pregnancy and the ones not safe.
Hop Step is from Duke,
Okay.
and that is probably my favorite resource that's
Okay.
available. And if you can go to Hopstep, or I think it's lupuspregnancy.org. I actually
Mhm.
have those their handouts printed out and on my wall in the clinic because they're
Nice.
so helpful talking about both contraceptive options in
Hmm.
rheumatic disease and particularly in lupus, and then pregnancy in lupus. And that I think